Welcome to today's COVID-19 update. Of course, we're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you once again for having me on this program.
Yes, sir. I want to ask you, one of the major news coming out internationally is that Ghana has just gotten its vaccine through the COVAX mechanism. This, of course, is exciting news because many countries like Ghana are awaiting their vaccines as well.
Well, COVAX has started to roll out the vaccines to different countries, and Ghana is one of the first to receive those vaccines. As you know, there are more than 180 something countries that are part of this COVAX facility. And we will see over the next coming days and weeks that many more countries would be receiving their vaccines.
Just a bit of a reminder, we are getting 104,000 vaccines through COVAX, right?
We are, as you know, we are part of the COVAX facility, but we are also a part of what is called the COVAX AMC countries, meaning that we will be receiving our vaccines free of cost. In terms of dosage, we expect to receive doses to cover 20% of our population, and maybe in a first allotment, we can get doses to cover probably about 25 to 30%. So we're expecting some discussions with COVAX to finalize dates and times of arrival of the vaccine. And so once we get those dates and times, we'll be able to make that known to the public.
Yes, sir. Some other international news that came out is that the Russian vaccine is now available, and we were, I don't remember the exact article, but it did indicate that the Ministry of Health in Ghana will be receiving those vaccines.
Yes, well, as you know, one of the things that vaccine makers would like to see is to ensure that the country where the vaccines is going to, that they've granted permission for the use of the vaccine. In the case of the Sputnik 5 or Sputnik V vaccine, we have been in discussions with the Russian manufacturer for quite some weeks now, and I've indicated this before, because when we review the data from the vaccine, we saw that the vaccine is about 90.6% efficacious. And of the vaccines so far, this one has very high efficacy. And so we have started discussions with them in order to be able to get some of these vaccines to Guyana. Those discussions have advanced, and we have been able, through our Food and Drug Administration here, to issue an emergency use authorization for these vaccines. We have also issued emergency use authorization for the Sinopharm vaccine, which has an efficacy of 79.4%. We have issued the emergency use authorization for the AstraZeneca vaccine. And in different countries, it goes by different name. So in India, for example, the AstraZeneca vaccine is called Covaxin. And we have been able to issue that. In fact, it's called COVID Shield, rather.
COVID Shield.
Covaxin is another manufacturer in India. But the COVID Shield has also received emergency use authorization in Guyana. Our process of issuing emergency use authorization, we looked at three main sources, how we can do that, or three main ways in which we can do that. The first is if the vaccine has been approved by what is called a stringent regulatory authority. So when we talk about stringent regulatory authorities, We're talking about the FDA in the United States, in Canada, in the UK, in Australia, and in Europe, they have a similar body, but it's named differently, not FDA. So
Okay.
once it has been approved by these authorities, then we would use the principle of reciprocity to be able to approve it here in Guyana. Another way of approving these vaccines is if they have been approved by the World Health Organization. And in the case of, so far, the WHO has only approved two vaccines, and that is the Pfizer vaccine and the AstraZeneca vaccine. They have Sputnik, which is going to be, they have submitted the paperwork, and I'm sure very shortly that that is going to go through a process of approval. And similarly with Sinopharm, which the WHO already has the documentation, and they should be processing that as well.
Okay.
And the third method that we use is if this vaccine has been approved by one of the bigger countries in the region or part of South America, the Caribbean region. And in the case of the Sputnik vaccine, we have seen that it has been given emergency use authorization in Brazil and in Argentina. And my understanding too that it has been used in St. Vincent and the Grenadines.
Okay.
So we are working with these bodies, and based on their findings, our FDA has been able to grant that emergency use authorization.
All right. Interesting that we talk about emergency use authorization because I read too that the Johnson and Johnson vaccine has been given emergency use authorization by the FDA.
Mhm.
So that I believe will be heading to the WHO for the same as well.
Right, and the Johnson and Johnson vaccine is in a way similar to the Sputnik V vaccine because Sputnik V consists of two doses. Um, the first dose is using an adenovirus 26 vector,
Okay.
and the Johnson and Johnson vaccine uses a similar principle.
Okay.
So in a way, they're similar, but
Okay.
perhaps not the same.
True. I had a follow-up question for you with regards to the Sputnik vaccine from Stabrook News and the Ghana Chronicle. They were asking if we're expecting some of those vaccines in Ghana very soon, and if perhaps there's a number as to how many we will receive.
We are finalizing those arrangements, and once we have the details, we'll be able to release that. But as of now, we're still working on the amount of doses and when it would arrive and so forth.
All right, Minister, we have a few other questions. Stabrook News as well. They were asking about the businessman who had received the COVID-19 vaccine and whether he would be receiving the second dose as he had the first one.
Those matters right now, as you know, the hospital is conducting an investigation, and I suppose when we finish all of that, we'll then be able to answer some of those questions.
Yes, sir. Yesterday was, of course, our Republic anniversary, and obviously we know Republic equals is Mashramani. So we have seen a few reports of persons who had breached some of the COVID-19 guidelines. We just wanted your thoughts on some of what was reported yesterday.
Well, it's unfortunate that people would still want to gather in large crowds, knowing fully well that it's not just about violating the guidelines that we have put in place. We have put those guidelines to keep people safe. And if you are going to knowingly put yourself at risk, then I don't know what else to say because everyone knows that if you are in crowds, that you can encounter someone that probably may be asymptomatic or mildly symptomatic for the virus. And if they're not wearing their mask or keeping their distance, then you can become infected. So it's unfortunate that we are almost 1 year into this pandemic here in Guyana, and we still have to explain these fundamentals to people. Because if people do the right thing and abide, our cases are going to come down, we'll get less hospitalization, and eventually, when we get the vaccines and we're able to immunize people, then we can start thinking about some level of normalcy. But until then, people still have to follow these rules,
Yes,
right? It's not that we want to punish people, we want them to be safe. And the only way you can be safe is that you have to follow these rules.
all right, Minister, before we wrap up, I just want to push in one question from Nightly News. They're asking when does the Minister of Health anticipate Ghana would receive herd immunity against the coronavirus? We had spoken about this before, so just to ask for them.
So, herd immunity is really population immunity. So, you have to be able to immunize enough persons within the population so as to restrict transmission of the virus. At our current stage where we are at, giving the population immunity can be done basically in two ways. The first is to allow people who get sick from the virus and recover, they would have what is called natural immunity, and that eventually contributes to herd immunity. But if we're going to use that method, which is not recommended, because in that way, a lot of people are going to get sick, a lot of people are going to end up in the hospital, and a lot of people are going to die. So obviously, that's not the recommended way. But those who have been ill with the disease and have recovered would certainly have some level of natural immunity to the disease. The other way that is available to us is for us to use a vaccine which, when given, would be able to stimulate your immune system to produce antibodies. And so, if you encounter the disease, you become more resistant to the disease, and your body would be able to fight off the disease quite readily. So, that's why vaccines are important. And we are making the best efforts to be able to have enough vaccines for the adult population in Guyana, because these vaccines have not been licensed for use in the children population. So with Pfizer's vaccine, they go it's from 16 years and above, but for all other vaccines, it's 18 years and above. And you know, the persons below 18 in our country makes up a sizable part of our population. So since we would not be able to immunize them, then if we are going to achieve herd immunity, it means that most of our adult population would have to receive this vaccine before we can say that we have immunity or herd immunity. There's also another factor, because depending on how we roll out and how fast we are able to roll out the vaccine, that would take some time for us to do. Okay. But our plan, as we get the vaccine, our focus, as you know, would be first of all to give to the health frontline workers, which we have started doing with the 3,000 doses that we have received. And as of today, we would have given more than 2,000 doses to healthcare workers. So that is going to continue. We want all our healthcare workers to be immunized, and then for them to come back, of course, for the second dose. After which, we are going to be able to do persons who are, older, so 60 years and above. And of course, we want to do those persons with comorbidities, because we know a lot of people who have comorbidities would have a higher risk for the disease. So once we finish with frontline health workers, older persons and persons with comorbidities, then we'll move to other persons in the population, adults, that we can immunize. So as you can imagine, this is going to take a couple months for us to achieve that. Um, Initially, we would be able probably to return the country to some state of normalcy after a couple of months. However, that would not still be the end of the epidemic. For us to have that um, epidemiological endpoint, that would take a little bit more work and to ensure that a larger percentage of our population are immunized. And then there are things that we're still trying to figure out from the science that those answers might become available to us perhaps in about 2 to 3 months from now. So there's still a lot of work that we have to do. And while we are working on getting vaccines and rolling out those vaccines, people would still have to abide by the non-pharmacological methods that we have been talking about. And that is wearing your mask, watch your distance, and wash your hands. If people can abide by this, at least we would reduce the amount of cases that we have so that, when we get the vaccines, we can then prevent people from getting sick.
Okay, Minister Anthony, thank you so much for speaking with us.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.